Is talk to you about two specific areas in the arm, the axilla and the cubital fossa. So let's start with the axilla. It's rather a strange shape. It's lying, of course, between the arm and the thorax, and it is really a truncated cone. It's like a cone which has had its top removed. The upper part of the cone leads through behind the clavicle into the neck, and then below it leads down into the lower part of the axilla and of course the arm itself. It's worth considering its borders and limits. First of all, let's look at the posterior wall. Now the posterior wall is really three muscles. It's subscapularis, it's teres major, and it's the tendon of latissimus dorsi. They make up the posterior wall. The medial wall, which is the actual wall of the thorax itself, is covered in the axilla by the various slips of the serratus anterior muscle. Of the 8 slips, some 4 slips are the medial wall, and the other 4 slips are down below the axilla itself. The medial wall is serratus anterior. The anterior wall is slightly more complicated because it consists of the pectoralis major with the pectoralis minor lying just beneath it, and the pectoralis minor itself is in amongst the clavipectoral fascia. So in summary, the anterior wall is both the pectoralis major, minor and clavipectoral fascia. The lateral wall is rather surprising because it is the intertubercular or bicipital groove of the humerus, with the biceps tendon lying within it, and in its floor the tendon of latissimus dorsi. You might find this odd that this intertubercular groove should be the lateral wall when you normally think of it as being lying on the anterior border of the humerus. But if in fact the arm is internally rotated, it's easy to see why this is the point where the posterior and anterior wall meet. The apex of the cone is the clavicle itself, the scapula, and the outer border of the first rib. Lying within the axilla is the long head of biceps in the bicipital groove, the tendon of latissimus dorsi, the teres major, the long thoracic nerve lying on the surface of serratus anterior, the axillary vein, and the axillary artery with the cords of the brachial plexus arranged round it in the order of their name, i.e. lateral, medial and posterior. Also one could regard the pectoralis minor as being within the axilla, although it is of course also part of the wall, and then coracobrachialis and the short head of biceps are also included. The floor of the axilla is slightly more complicated. It is actually a layer of axillary fascia which is held up by a suspensory ligament. This floor lies between the two axillary folds, the anterior and the posterior, and it consists of the deep fascia of the arm and, of course, serratus anterior on the medial side. When considering the contents of the axilla, we must, of course, remember the lymph nodes, which are so important both for lymphatic drainage of the arm and for the breast. The lymph nodes are named according to their position. So there's an anterior group near the anterior axillary fold, a posterior group near the posterior fold, a lateral group on the arm side, and these all drain up into a central group, which in turn drains towards an apical group, into which also the infraclavicular group drain. From the apical group there is the subclavian lymph trunk, which drains up as appropriately on each side. Now let's turn to the cubital fossa, an area on the anterior aspect of the arm between the arm itself and the forearm. It's a triangular area with its boundaries being the pronator teres muscle on the medial side and brachioradialis on the lateral side. and then the third part of our triangle is a line between the epicondyles. Its roof is the deep fascia of the forearm, and this includes the bicipital aponeurosis, which is a sheet of thick fibrous tissue emerging off the medial side of the biceps tendon. Lying also in the roof is the median basilic vein, the median cephalic vein, or often just easily summarized as the median cubital vein. Also in the fascia of the roof is the medial and lateral cutaneous nerves of the forearm. The floor of the cubital fossa is the brachialis muscle above and supinator muscle below. The cubital fossa contains the median nerve and the brachial artery and the tendon of biceps. The order of these structures from lateral to medial is T-A-N, tendon, artery and nerve, and this is a useful way of remembering the order. If we lift brachioradialis a little bit, just under its margin, we will see, lying between brachioradialis and brachialis, the radial nerve as it emerges from the spiral groove behind the humerus. Follow it down and we'll see it changing as it enters supinator into the posterior interosseous nerve and also the superficial branch of the radial nerve. Another important contents of the cubital fossa are the lymph nodes. It's worth noting that any infected lesion on the hand and anterior surface of the forearm will drain primarily to these lymph nodes in the cubital fossa, whereas any other infected lesion on the back of the hand or back of the forearm will drain directly to the axilla. Deeply down at the lower border of the cubital fossa, we'll see the brachial artery dividing into a radial artery and an ulnar artery, and then the ulnar artery itself giving off a common interosseous artery which has an anterior and a posterior branch. It's probably worth noting that when a needle is passed into the median cubital vein to remove blood or to give injections, intravenous injections, that the median nerve and the brachial artery are at a small risk of damage, but the main protection for them is the tough bicipital aponeurosis of the tendon of biceps.